Okay, next morning, everyone. Let me share my presentation first. Okay.
All right.
So the topic tonight is on thrombosis and inflammation, but I have taken the liberty to include oxidative stress as well into this complex relationship, so that we have a bigger picture. But I think it would be good to start with just revising on what is blood clotting all about in the first place. Let's start with the basic about what is hemostasis. That is the process whereby our blood vessels try to stop the bleeding whenever it is injured and is leaking blood. And this involves two stages. The first part is the blood vessel constricts to reduce blood flow. And the second part is the coagulation or the blood clotting process to form the blood clot or thrombus. And this involves the platelets and the clotting factors. Under normal circumstances, the blood clotting tendency is maintained in a delicate balance with its clot dissolving ability. This prevents abnormal clotting and abnormal bleeding. However, there are conditions where the blood clotting tendency is increased, leading to thrombosis, which is abnormal blood clot formation, or the tendency can be decreased, leading to abnormal bleeding. So tonight, we are focused on thrombosis, but let's revise first. How are clots formed? So when the blood vessel is injured, then there's a blood vessel constriction. So that involves blood vessel. But what about the blood itself? With or without the blood vessel involvement, how does the blood clot? So there are the platelet factors. As soon as the blood vessel wall is damaged, a series of reactions activates platelets so that they stick to the injured area. The glue that holds platelets to the blood vessel wall is von Willebrand factor, a large protein produced by the cells of the vessel wall. The proteins collagen and thrombin act at the site of the injury to induce platelets to stick together. And as platelets accumulate at the site, they form a mesh that plugs the injury, and the platelets change shape from round to spiny, and they release proteins and other substances that entrap more platelets and clotting proteins in the enlarging plug that becomes a blood clot. Okay, so that's how the platelets play their role. And it's inseparable from the some clotting factors. But there are other clotting factors that come into play. So formation of a clot also involves activation of a sequence of blood clotting factors, which are proteins produced mainly by the liver. There are a dozen blood clotting factors. They interact in a complicated series of chemical reactions that ultimately generate thrombin. Thrombin converts fibrinogen, a blood clotting factor that is normally dissolved in blood, and this then is converted into strands of fibrin that radiate from the clumped platelets and form a net that entraps more platelets and blood vessels. The fibrin strands add bulk to the developing clot and help hold it in place to keep the blood vessel wall plugged. Okay, so there's an injury, and then first blood vessels constrict, and then the blood itself will go into play, which involve the platelets and the clotting factors. So in the end, you have the activated platelet and you have the fibrin forming a lump over the red blood cells, and you have the blood clot. So that's in normal circumstances. In abnormal circumstances, the clot form without a cut in the blood vessel, and the blood form inside the blood vessel. So this is thrombosis. Thrombosis is the formation of a blood clot or thrombus inside one of your blood vessels or a chamber of your heart. Clots can block blood flow in your blood vessels or break free and travel elsewhere in your body. If a moving clot, there's an embolus, all right, gets stuck in a critical area, it can cause life-threatening conditions like stroke and heart attack. All right, so the blockage caused by an embolus, and that is the phenomenon of embolism. So what are the complications of thrombosis? Thrombosis can lead to many different complications depending on where the blood clot forms or travels to. If it's in the lungs, it's pulmonary embolism, usually coming from the legs. If it's a brain, you can have transient ischemic attack, TIA, or a massive one would be a stroke. In the heart, there is a coronary artery, you have a heart attack. Or if it's mild one, it is angina. In the neck, you can have TIA or stroke, just like if it's right in the brain. Right? In the abdomen, in the superior mesenteric artery or one of its branches, you have mesenteric ischemia, which can be very painful. And in the legs, usually it is deep vein thrombosis. So there are three types of thrombosis. You have arterial thrombosis, and this is the most common cause of heart attacks and strokes. And then you have a venous thrombosis, the common cause of pulmonary embolism, because usually arising from the deep vein thrombosis and travels to the lungs. And then you have cardiac thrombosis, usually as a result of atrial fibrillation. So the blood clot is formed in the heart chamber and can travel to the lungs, to the brain, and to organs, depending on which side of the heart. And how common is thrombosis? Thrombosis is extremely common and is the underlying cause of 1 in 4 deaths worldwide by causing heart attack, stroke, or pulmonary embolism. Thrombosis is more common among people with certain medical conditions, including atrial fibrillation, cancer, coronary artery disease, diabetes, clotting disorders such as antiphospholipid syndrome, and those who smoke. And what are the symptoms? Of course, the symptoms depend on the size of the clot, its location, and the complication it causes. Blockages are more likely to occur in areas with very small blood vessels, especially your lungs, brain, and further down in your legs and arms. So if you have pulmonary embolism, then you have sharp pain in the chest and surrounding areas, the jaw, neck, shoulder, back, or arm, and the pain when you breathe in, and sudden trouble breathing when active or at rest. Remember, embolism tends to happen suddenly because of sudden blockage. When the blood clot gets lodged in a vessel, it cannot go further. If it's in the brain or neck, then you have TIA or stroke, depending on how big is the blockage. So there's weakness or trouble controlling muscles on one side of your body, slurred or garbled speech, noticeable droop and lack of muscle control on one side of your face, and confusion, agitation, or otherwise unusual behavioral changes. If it's in the coronary arteries, then you have heart attack with chest pain or discomfort, trouble breathing, dizziness, or passing out. But females may have additional or atypical symptoms. If it's in the abdomen, as mentioned earlier on, you have mesenteric ischemia, you have severe stomach or abdominal pain, especially after eating, bloating, nausea and vomiting, diarrhea, and which may contain blood, and fever. If it's an artery in arm or leg, then the skin becomes pale than other areas because there's less blood flow. The skin that feels cool to the touch, weakness and inability to move the affected body part, numbness or tingling, pins and needles, possibly with pain, blisters, wounds, or sores because of poor blood circulation, skin sloughing, which is when skin falls away from the tissue underneath, and there's necrosis or tissue death. If it's in the vein in the arm or leg, then the skin looks redder or darker than other areas, okay? Compared to if it's arterial, then the skin looks pale. If it's venous, the skin looks redder or darker. There's pain, especially around the affected area. There's swelling from fluid build up, and the skin feels warm to the touch. Okay, as opposed to if it's arterial, the skin feels cool to the touch, lack of blood flow. But if it's venous thrombosis, it feels warm because there is blood clogging up there. What causes thrombosis? Thrombosis happens when something damages the inner lining of your blood vessel, that is the endothelium, and we've had this at the last discussion. And this can also, thrombosis can also happen when there's a rupture of the atheromatous plaque, as mentioned in the previous talk. Or when the blood flow is too slow and the tendency to induce clotting is high, or when there is a vessel wound causing leakage of blood that triggers the blood clotting mechanism, or when the clotting tendency is enhanced by certain conditions, right? Either for diseases or drugs. Under normal conditions, if you have a wound, platelets and proteins join together at the site of a vessel injury to serve as a plug. This multi-stage process of hemostasis forms a necessary clot that helps you from losing too much blood. The clot dissolves when your wound heals. However, various medical conditions, medications, and other factors can cause enhanced clotting tendency. As a result, a blood clot or thrombus may form and potentially get bigger. It may also break away and travel through your bloodstream until it gets stuck in a blood vessel, in a smaller blood vessel. That is, the embolus gets stuck and you have the phenomenon of embolism. What are the risk factors for thrombosis? Anything that interferes with your blood's ability to flow freely or clot normally can raise your risk for thrombosis. This includes many conditions, medications, and lifestyle factors such as atherosclerosis, atrial fibrillation, just being over age 60, blood clotting disorders, cancer, chemotherapy, diabetes, family history of blood clots, having certain surgeries or procedures done, heart failure, heart valve disease, high blood pressure, high cholesterol, inflammatory or autoimmune diseases, obesity, paralysis of a leg, pregnancy is a high-risk situation, prior heart attack or stroke, sitting still for too long for various reasons, including long flights or bed rest, tobacco use, using birth control pills containing estrogen, and using HRT for menopause symptoms. Okay, now let's zoom into thrombosis, oxidative stress, and glutathione. Studies have shown that thrombosis is associated with oxidative stress. And studies show that there is increased glutathione peroxidase, the antioxidant enzyme in those with thrombosis, which indicates there is increased utilization of glutathione to combat the oxidative stress. And studies also show that those who have GPX deficiency is associated with having increased risk of thrombosis. All right, so it is obvious that glutathione has a role in thrombosis because underlying factor is oxidative stress, and it has been shown that glutathione, the body uses glutathione to try to reverse the oxidative stress, and the lack of the glutathione system enzyme GPX will increase the risk of thrombosis, which also means lack of glutathione also increases the risk of thrombosis. Secondly, studies show that glutathione reduces platelet aggregation, which means it will reduce the tendency for thrombosis. Thirdly, while glutathione reduces the tendency thrombosis when the tendency is abnormal. On the other hand, fibrinogen, which is a factor in thrombosis, and a factor in clot formation. Fibrinogen itself is susceptible to oxidative stress, just as some other clotting factors too are. And studies show that uric acid and glutathione are its strongest protectors, right? So not only glutathione affect those factors that reduce thrombosis, but glutathione also affect those factors that tend to form thrombus, which means glutathione acts on both sides of the equation, right? It helps normalize the clot forming process. It also helps normalize the clot dissolving process. That's how important glutathione is in maintaining the balance of your clotting tendency. Let's look at inflammation and thrombosis. There are complex interactions between inflammation and hemostasis, which is the process of stopping bleeding, which includes coagulation. And these interactions involve pro-inflammatory cytokines, chemokines, adhesion molecules, tissue factor expression, platelet and endothelial activation, and microparticles. Chronic inflammation may cause endothelial damage, and we know this, and that is the starting point of coronary arteriosclerosis is chronic inflammation. So this chronic inflammation, after causing endothelial damage, resulting in the loss of physiologic anticoagulant, anti-aggregant, and vasodilatory properties of endothelium. So the healthy endothelium has a normal, healthy, balanced control of anticoagulants and anti-aggregants and vasodilatory control, right? Which means it maintains the balance between the tendency to coagulate, right? The tendency to aggregate cells and platelets, and the ability to dilate. Unfortunately, coagulation also worsens inflammation, causing a vicious cycle, okay? So inflammation pushes the tendency towards coagulation. Coagulation further worsens inflammation, so you can start a vicious cycle. So as a result, inflammation increases pro-coagulant factors and also inhibits natural anticoagulant pathways and fibrinolytic activity, that is the clot dissolving activity, causing a thrombotic tendency. All right, as a result of all this, inflammation will tend to cause